what are the tests or screenings you would recommend in a preconception stage when they are planning a pregnancy?
So I'll tell you what. So whenever you are planning it, once you decide you started to plan it, go to your doctor. Firstly, visit your gynecologist or your fertility specialist. What we generally tell is there are some simple tests like your CBC, which basically tells you your hemoglobin, ki anemia hai ya nahi.
Right.
Because anemia itself can have an effect on ovarian health and sperm health. Then we do your sugars, because India is the diabetes capital of the world. Indian women, especially when they're pregnant, have a 10 times risk of developing diabetes in their pregnancy as compared to our Western counterparts.
Right.
So we want to make sure that you're not diabetic beforehand or you're not at a risk of diabetes. Thyroid function is another thing that we tell all our female partners to do, because thyroid can cause irregular periods, heavy bleeding. It can even cause recurrent miscarriages. So that's something that we look into. And a couple of hormonal tests like your serum prolactin, because that's another test which can affect your ovulation, like how your egg is growing, and your AMH. Now this AMH report is what tells you कि ovaries में कितना strength है या कितना strength बचा है. So whatever happens, this is to the entire audience. जो right side पे reference reports आते हैं ना, वो please मत follow कीजिए. जो result आता है वो visit your gynecologist, understand from them, because those reports are not representative of what comes there. We know how to analyze that and tell you. So that tells us कि this lady has a low ovarian reserve, मतलब उसके अंडे कम है, normal है कि उनको PCOD की तकलीफ है. And we always get a sonography done to just make sure कि uterus is got any fibroids or is there any endometriosis or anything like that. Now tube testing, we generally let the couple try naturally for a bit, और अगर pregnancy नहीं रुकता है तो फिर we consider tubal testing. In the husband, the main test to be done is the semen analysis, मतलब धातु की जांच, where we are looking at the count, we're looking at the motility, matlab its ability to move forward the sperm. And we look at how many normal sperms are there. Do you know you just need 4% normal sperms to get pregnant? So it's not much that you're asking of the sperms to do, but at the end of the day, still you need to get checked out.
Right.
So these are the tests which we ask the couple to do when they're looking at planning a pregnancy. Because if there's anything that is not right in that range, we as doctors then come in to help you correct it. And 99% of the times, the treatment is just pure lifestyle modification along with some micronutrients and multivitamins. But the chances of us adding medicines comes in much later if we see any major problem that's there. But usually we just give them antioxidants, micronutrients, multivitamins, and we tell them to change their lifestyle, which will just help them get pregnant faster. In fact, I literally yesterday, this afternoon before I'm meeting you, I got a call from a patient who came to me. She's been married for 6 years. They came to me and they told me that, Rohan, we want to now start planning a pregnancy. I got their tests done and everything. They've been on multivitamins since a month and she's been having pain in abdomen. She's like, Rohan, I've had so much pain. I'm not doing well. Everything, all her reports, everything is there. And she's like, in all this gadbad, I forgot to tell you, I've not got my period since a month. I said, please do a pregnancy test ASAP. Literally, she's pregnant right now. So that's what I'm saying, that just a change in your lifestyle, these simple antioxidants, multivitamins can change your entire treatment process. In fact, there's so many patients which we saw during COVID who froze embryos with us. They got pregnant naturally during COVID because the stress of work was gone. They were finally spending time together. That's one of the biggest problems I've seen. मतलब बोलते हैं कि हम लोग plan कर रहे हैं, पर they're never with each other.
Yeah.
They have high stress jobs. They're coming back. They're leaving home at 6 a.m., coming home at 10 a.m. When are they going to have time to be together? One important factor about preconceptional health, which I forgot to mention, adequate sleep. That is something that is one of the most important things in your preconceptional health. Because what happens is when you don't sleep properly, your hormones also take a toll. And that can sometimes affect your ovulation and then affect your chances of getting pregnant as well.
So basically, you very clearly, आपने बहुत अच्छे से समझाया है कि फीमेल के लिए एंड मेल के लिए just these few changes, simple things to follow, can actually change their fertility health,
Absolutely.
right?
Yes.
And it is not difficult it's not like कि हर चीज को treatment चाहिए.
It's वही problem
मतलब
है.
आप सोचो, लोग स्पेशली हमारे इंडिया में कपल्स अगर 6 साल प्रेग्नेंट नहीं हो तो कितना स्ट्रेस हो जाता है फैमिलीज में,
Family pressure.
उनमें प्रेशर, उनके खुद के माइंड का प्रेशर, फैमिली का प्रेशर, peer pressure, and all because of lack of knowledge
Lack of
and
awareness.
wisdom and awareness,
Absolutely.
right? And that is where you realize why fertility health specialists are so important. Like they can really simplify your life in the easiest of possible ways. But honestly, आज तक किसी को पता ही नहीं था कि इस लाइन में आपने गायनाकोलॉजिस्ट के बारे में सुना, IVF स्पेशलिस्ट के बारे में सुना कि फर्टिलिटी हेल्थ स्पेशलिस्ट भी होते हैं. I think that awareness
So
itself is
I
needed
think
in India, right?
we are trying to change a terminology of IVF specialist to fertility health specialist.
Right.
So that is something that we're trying to bring aware, that fertility health or reproductive health जो हम बोलते हैं,
बिल्कुल.
this starts in your teenage years. It's not just when you become an adult.
Absolutely.
It's all about all the decisions you make when you're 14, 15, which are going to be a part of your journey till you hit menopause. So your reproductive health actually plays a role. That's why abhi, even the government is talking about the HPV vaccine. We're talking about safe sex protocols and things
Right.
like that, so that we want to prevent any girl from getting any infections or having any trouble in future conception.
True.
So that is the main thing. And simple things, like I'm saying, awareness, education, knowledge. आपने start ही किया था, empowerment through
Absolutely.
knowledge
Absolutely.
is going to empower women to take control of our own reproductive health. Then at that point, we just come as guidance counselors more than your treating doctors.